The chapter-by-chapter summary of the book titles Yoga for Bronchial Asthma by Dr. R. Nagratna and Dr. H. R. Nagendra. Chapter 1, Introduction. This chapter introduces the book, which is the second revised edition of New Light for Asthmatics, first published in 1998. It notes that the integrated approach of yoga therapy for asthma management is now universally recognized by most asthma caregivers. The book aims to make relevant concepts and practices accessible to the busy person. It highlights the increasing awareness among both asthmatics and clinicians, partly due to beneficiaries spreading the message and cooperating in research that gave a scientific stamp to their experiences with yoga. The authors thank various contributors to the book. The introduction reflects on the third millennium, where despite technological advances in healthcare, stress and stress-related ailments are rising, leading people towards alternative therapies. It notes the taken-for-granted nature of breathing until difficulty arises and points out that changes in mind and emotions are almost instantly reflected in breath. The term asthma is of Greek derivation, meaning panting or gasping. Bronchial asthma is specifically about a problem in the bronchi, the lower air conduits. It is characterized by recurrent attacks of difficulty in exhalation due to widespread reversible narrowing of airways in the lungs, varying in severity spontaneously or with treatment. Common features include episodes of breathlessness and wheezing, whistling noise, while breathing out. A hallmark is remarkable hyperreactivity of the air passages and excessive response by narrowing to various stimuli. It is clarified that this condition is not due to any known specific infection but is characterized by airway inflammation and bronchial hyperresponsiveness. Chapter 2, Anatomy and Physiology of Respiratory System. This chapter provides an overview of the respiratory system. Breathing enables every cell in the body to receive oxygen and eliminate waste products like carbon dioxide and water. Respiration involves two processes: internal, gas exchange in tissues, and external, gas exchange in lungs. Air is drawn into the lungs during inspiration and expelled during expiration. Anatomical features described include the nose, divided by septum, with nasal conchae, vestibule, mucous membrane, cilia, mucus-secreting cells, and nerve endings for smell and protective sneezing reflex. The trachea, windpipe, about 10 centimeters long, divides into bronchi, held open by cartilage rings, and the lungs, principal organs, fill chest cavity, right lung with 3 lobes, left with 2. The bronchi branch extensively into smaller bronchioles ending in alveoli. The inner lining of the bronchi has ciliated cells to remove pollutants and mucus-secreting cells for lubrication and humidification. A thin circular layer of smooth muscles in the bronchus controls narrowing and dilatation, regulated by a complex neurochemical mechanism. Alveoli are the air sacs where oxygen diffuses from inhaled air into blood, and carbon dioxide moves from blood to the air sac across a thin membrane. The mechanics of breathing involve inspiration, purika, which is active, and exhalation, rikeka, which is normally passive. Inspiration is achieved by the expansion of the thoracic cage, involving muscles like the diaphragm, enlarging the chest vertically, intercostal muscles, elevating ribs for forward/outward expansion, and clavicular muscles, pulling up sternum/clavicle for upward expansion, used in deep forced breathing. Abdominal muscles assist during forced respiration, breathing out. Lung function tests measure lung volumes using a spirometer. Key measurements include tidal air, air breathed out at rest, vital capacity, VC, max air exhaled after deep inspiration, residual volume, RV, air remaining after complete exhalation, forced vital capacity, FVC, VC exhaled forcibly, and slow vital capacity, SVC, VC exhaled slowly. In asthmatics, FVC is less than SVC. Forced expiratory volume in the first second, FEV1, is measured from the FVC curve, normally 80% of FVC. This ratio is reduced in asthmatics but improves after a bronchodilator. Peak flow rate, PFR, measured with a portable meter, correlates with the FEV1/FVC ratio and is a good indicator of bronchoconstriction. Instructions for using a peak flow meter are provided. Chapter 3, Causes of Asthma and Nasal Allergy. This chapter explores how the narrowing of bronchial airways occurs in asthma. Airway narrowing is due to inflammation of the inner lining, resulting in swelling and engorgement, which reduces the airway lumen. Secretions poured from the swollen mucosa further decrease the effective lumen. These secretions are characteristically sticky in asthma attacks. The process involves cell signaling and the recruitment and migration of inflammatory cells, leukocytes like eosinophils, neutrophils, lymphocytes, and monocytes, into the airways, starting within 2 hours of allergen exposure and potentially continuing for up to 48 hours. Evidence suggests inflammation affects multiple levels of the bronchial wall, epithelium, basement membrane, smooth muscles, and nerves. The source notes the possibility of abnormal or incomplete repair mechanisms after inflammation stops, potentially leading to chronic persistent inflammation and repeated attacks. Further research is needed on resolution processes to understand asthma severity differences and develop better therapies. The chapter includes a reminiscence from a participant who found immense benefit in a yoga therapy camp, overcoming severe asthma symptoms and rarely experiencing attacks after regular practice. It also warns that undersensing asthma symptoms is unsafe, as patients may have severe airflow obstruction without feeling it, potentially leading to a dangerous state. Chapter 4, Management of Asthma. Asthma is described as a chronic inflammation of the airways. While attacks can be episodic and reversible, many asthmatics experience chronic irreversible obstruction due to airway remodeling. Key aspects of remodeling include subepithelial fibrosis, thickening under the inner lining, goblet cell hyperplasia, submucosal gland hypertrophy, and increased vascular permeability, all triggered by chronic inflammation. These changes occur early in the disease, within the first few years. Thus, long-term management should aim at the underlying remodeling, not just symptom management. Drug therapy aims to give patients control over their asthma. Certain drugs like aspirin and beta blockers should be avoided as they can cause or worsen asthma. Asthma drugs are categorized into relievers, quick symptom control, and preventers, control inflammation. Inhaled medications, aerosols via MDI, DPI, nebulizer, are preferred due to lower dose, fewer side effects, and better effect. A graded approach is recommended, using minimum medication. Reliever inhalers are used as needed. If usage is minimal, less than 1 puff/day, no further drug treatment may be needed. Step I. Short-acting beta-2 agonist use should be minimal. Long-acting beta-2 agonists enhance long-term control but lack anti-inflammatory activity and are not primary therapy. Theophylline inhibits early and late reactions and has some anti-inflammatory effects. Antimuscarinic drugs block parasympathetic nerves, causing bronchial muscle relaxation, with uncommon side effects in inhaled forms. Preventive therapy, focusing on controlling inflammation, is a central objective. This is crucial for better disease control and potentially altering its course. Environmental measures are important in allergy-driven asthma to eliminate triggers. Pharmacologically, corticosteroids, inhaled or oral, are primary, decreasing inflammatory cells and cytokines, improving symptoms. Inhaled steroids have much lower doses and fewer side effects than oral steroids, and their dangers are far less than those of undertreated asthma. Higher doses can have more side effects, which can be minimized by mouthwashing and spacer devices. Sodium chromoglycate is effective for milder childhood asthma, especially exercise-induced symptoms, and has virtually no side effects. Netochromal has similar preventive strength to low-dose inhaled steroids. Leukotriene E blockers, Singulair, Accolade, are new preventive drugs with slight bronchodilator effects and seem to have few side effects. Emergency management for acute attacks involves large doses of reliever drugs, often via nebulizer, and anti-inflammatory drugs, steroids. Prompt medical attention is crucial as delay can be dangerous. Psychological methods discussed include psychotherapy, awareness of psychological conflicts, handling issues through discussion and knowledge, behavior therapy, deconditioning hyperactive reflexes like sneezing and bronchospasm using reward-punishment techniques, and hypnotherapy, coping with attacks, tapping mental power to correct body disturbances through suggestion in a dream-like state. Drugs for emotional stress can be risky in severe asthma due to respiratory depression. Methods for stabilizing vital energy are presented: homeopathy, corrects vital energy flow disturbances with minute drug quantities, symptoms move from center to periphery. Ayurveda balances vital energy aspects, vata, pitta, kapha, through herbal preparations, food habits, lifestyle changes. Acupuncture sets right vital energy chi flow disturbances by stimulating points on meridians with needles, and magnetotherapy corrects vital energy disturbances by altering magnetic fields. Acupuncture has shown minor benefits in mild asthma but not severe cases and is more accepted in medical circles, particularly for pain relief. Yoga therapy is presented as correcting the problem from the most fundamental level, aiming for total correction by addressing emotional, psychological, and vital energy levels through techniques leading to deep relaxation, calmness, or silence of mind. Yoga integrates effects of the previously mentioned methods. At the psychological level, yoga turns the mind inwards, fostering awareness of internal functions, helping resolve conflicts and change conditioned patterns. At the vital energy, prana, level, pranayama corrects energy flow disturbances by slowing down prana activity through conscious, slow breathing, which automatically sets right imbalances. At the body level, yogasanas enhance local relaxation and tolerance. Asthmatics can learn to relax their bronchus during an attack through yoga without drugs, reducing panic. The relaxation of voluntary muscles extends to involuntary ones, comparable to reliever inhalers. Awareness of the bronchus state provides biofeedback for self-relaxation via autosuggestions, like mastering involuntary functions. Yoga can also help correct the CGMP-CAMP imbalance linked to bronchial hyperresponsiveness caused by parasympathetic overactivity. Chapter 5, Health and Disease, a yogic perspective. This chapter delves into the yogic understanding of health and disease, outlining the concept of yoga and the structure of human existence. A diagram illustrates the progression from sickness, akin to animal man, to normal man and eventually superman/divinity, a state of higher consciousness with reduced basic urges and emergence of new faculties. Yoga is defined as a systematic conscious process for accelerating the growth of a human being from animal to divine levels, a methodical effort towards self-perfection by developing latent potentialities. It removes limitations and imperfections. Patanjali Yoga, one of the 6 systems of Indian philosophy, compiles essential yoga principles from Upanishads. According to Patanjali, Yoga Sutras 1.2, yoga is a process of gaining control over the mind, yoga siddhavrittinara. This control allows the seer, individual, to establish himself in his causal state, Yoga Sutras 1.3, tadadrastas varapi avasthanam. Mind control involves the power to concentrate and the capacity to remain quiet. Yoga primarily emphasizes the latter. Yogavasistha defines yoga as a skillful trick to calm down the mind, Manaprasamanopaya yoga ityabhidayate, describing it as a subtle process. Human existence is described through 5 sheaths, kosas, from the subtlest Anandamaya kosa, bliss, to the grossest Annamaya kosa, physical body. Subtler sheaths correlate with increased freedom, decreased bondage, and increased bliss. Panka kosa vivka, analysis of the 5 sheaths, and associated practices transform man by relieving bondages. The science of illness views diseases, vyadis, as potentially stemming from adis, ailments originating from the mind. Mental diseases, primary, are vasanas affecting the mind, while bodily diseases, secondary, afflict the body. Lack of transcendental jnana, insufficient control over senses, and growing desire/egoism contribute to our current state. Intense desires, ignorance, ajnana, and fearful actions can lead to bodily diseases. Other causes include unwholesome food and unhealthy environments. Primary diseases have ordinary, samanya, incidental to body, and essential, sara, rebirth, subdivisions. Samanya diseases, rooted in bad thoughts, vanish if these thoughts are destroyed. Sara disease, rebirth, requires atmajnana, self-realization. Grievous bodily diseases not caused by original bad thoughts can be treated with mantras, medicine, and medical means. The integrated approach is crucial for treating adhija vyadis, as disturbances in the mind, manomaya kosa, percolate to the body, annamaya kosa, via vital energy, Pranamaya kosa. This approach works at all levels, using various yogic practices to balance disturbances. Practices for each kosa are mentioned: Annamaya, kriyas, loosening movements; yogasanas, pranamaya, practices operating on vital energy; manomaya, dharana, dhyana, samadhi for mind culturing; vijnanamaya, knowledge from Upanishads, happiness analysis, lectures, counseling; and anandamaya, practices bringing bliss, like karma yoga. This integrated set of practices is used for prevention, treatment, and rehabilitation of asthmatics. Chapter 6, Breathing Practices. This section emphasizes the importance of breathing, a function often taken for granted, noting its connection to mind and emotions. It highlights how hereditary factors and childhood experiences can lead to chronic imbalances, wrong breathing rhythms, and asthma. Correcting breathing patterns is effective for both children and adults. The respiratory system acts as a bridge between the conscious and subconscious, body and mind, allowing voluntary control to influence involuntary functions. The objectives of breathing practices are to train for full lung utilization, normalize breathing rate, and make breathing uniform, continuous, and rhythmic. Practices include yogic cleansing techniques, sectional breathing, and full yogic breathing. Sithalikarana Vyayama, loosening yourself, practices, like forward and backward bending and side bending, are introduced. Pavanamuttasana Kriya is described as part of this, beneficial for digestion, releasing abdominal gas, preventing constipation, and shifting prana blocks. Benefits of loosening practices include improved back muscle stamina, posture, exercise capacity, increased blood oxygen, and calming the mind. The quick relaxation technique, QRT, is described, starting in Savasana posture, involving observing abdominal movements, synchronizing them with deep breathing, and breathing with feeling, energizing with inhale, relaxing with exhale. Chanting AAA during exhalation is part of this technique. QRT aims to harmonize and relax the system. Surya Namaskara, salutations to sun, combines yogasanas and pranayama, improving flexibility and preparing the body for other practices. It is performed with breath regulation and mantras associated with the sun god. Benefits include strengthening/relaxing muscles, opening the chest, training respiratory muscles, increasing awareness of involuntary bronchial muscles, annamaya kosa level, and balancing prana, releasing blocks and improving prana awareness, pranamaya kosa level. Chapter 7, Yogasanas. This chapter details yogasanas, distinguishing between two main types from hatha yoga, dynamic and relaxing. Dynamic asanas use speed, repetitions, and strength to shatter laziness, tamas, develop muscle strength and stamina, and aid growth, recommended for children and lethargic individuals. Relaxing asanas, based on Patanjali's principles, emphasize mental equipoise through relaxation and effortlessness, aiming for inner awareness and higher consciousness. They result in deep relaxation, energy conservation, freshness, and calm nerves. Recommended for those over 18, this system contributes significantly to energy channelization and control of bodily functions. Key features of yogasanas include evoking dormant potential, raising man towards total freedom, increasing spine flexibility, emphasizing positive health and personality development, and achieving mental equipoise, pranic balance, and physical stamina. The practice of yogasanas involves 3 stages during maintenance: sthira, steadiness achieved through practice; sthira, maintaining for prescribed time with effortless relaxation; prayatna sethilya; and sukha, effortless, comfortable posture where mind calms and experiences bliss by contemplating the infinite, ananta samapatti. Patanjali defines asana as sthira suksam asanam, steady and comfortable. Reaching the sukha stage for a sufficient duration leads to asanasthiti, superconscious state or samadhi, overcoming assaults from the pairs of opposites, tatodvanvanabhyata. This process yields benefits far beyond the physical. Ideal body characteristics achieved through yogasanas include balanced growth, agility, flexibility, strength combined with softness, relaxation in action, conserving energy, and tranquility of mind/clarity of thought, body-mind harmony. Yogasanas impact the physical body, Annamaya kosa, and promote stability and harmony in other kosas. Specific asanas and their benefits are listed, such as Ardhakati Kakrasana and Ardhamatyendrasana, which enhance spinal twist benefits and are linked to opening bronchial airways via the feeling of expansion, Salabhasana, which addresses forward stooping by building back strength, Sarvangasana stimulating urogenital/excretory systems and relieving constipation, Matsyasana complementing Sarvangasana and benefiting asthmatics, respiratory problems, and posture, and Halasana stretching back muscles, spinal joints, and enhancing neck blood flow. The deep relaxation technique, DRT, typically performed in Savasana, involves guided relaxation through body awareness, chanting Ukara and Aum, leading to visualization of vast space and merging into silence/bliss. DRT provides deep rest to the body, reducing oxygen needs and helping tissues remain healthy even with reduced oxygen supply, and gives deep rest to the nervous/immune systems, restoring normalcy. Chapter 8, Pranayama. This chapter introduces pranayama as the science of regulating and controlling prana, the basic life vitality. It notes that disturbances in prana flow are believed to cause diseases. Pranayama uses the regulation of breath to gain control over prana. Sectional breathing is a preparatory practice, correcting breathing patterns and increasing lung vital capacity. It includes abdominal breathing, adhama, using the diaphragm, thoracic breathing, madhyama, using the chest, and clavicular breathing, adya, using the upper chest and shoulders, each associated with specific mudras. Complete yogic breathing combines these sequentially. The three components of breathing are inhalation, parika, exhalation, rikeka, and stoppage, kumhaka. The goal of pranayama is kevala kumhaka, an automatic, effortless suspension of breath. Effects of kevala kumhaka include deep relaxation, lowered metabolic rate, blissfulness, and single-pointed awareness. Two schools of pranayama are described. The first involves forceful kumhaka with gradually increasing duration, though cautioned as potentially dangerous if not practiced with bandhas and discipline. The second school, emphasized in the book, focuses on slowing down inhale and exhale without forceful kumhaka, allowing automatic cessation of breath to occur naturally. This is considered a safer, smoother path. Specific pranayama practices listed include Surya Anuloma Viloma and Chandra Anuloma Viloma Pranayama, one nostril breathing, beneficial for nasal passages, allergies, and weight management. Cooling pranayamas, Saitali, Sitkari, Sadanta, performed through the mouth cool the system, soothe eyes/ears, purify blood, quench thirst, and satisfy hunger. Bhaitramari pranayama, humming sound, soothes the nervous system, cultures the voice, and helps center awareness for harmonious prana flow. Perfect health is associated with prana flowing in the central channel, Sushumna, with equal airflow in both nostrils. Chapter 9, Meditation. Meditation is presented as a yogic process providing deep rest by calming the mind. Research, such as studies on transcendental meditation, TM, indicates meditation can induce rest deeper than sleep. Meditation features include the mind dwelling on a single thought, deep relaxation, reduced metabolic rate/slowed breath, freshness, lightness, mental expansion, calmness, peace, bliss, and continuous awareness. Benefits include improved concentration, memory, emotional equipoise, and higher creativity. A simple meditation process involves sitting comfortably, relaxing, performing Bhaitramari, and then sitting silently, initially repeating Bhaitramari mentally and later listening to spontaneous inner sounds, nada. Focusing on nada calms the mind, leading to experiences of peace, silence, and expansion. Nadanusandhana involves chanting Akara, Ukara, and Mkara separately or combined as Aum to feel resonance in different parts of the body. Om Dhyana involves chanting Om audibly, then silently, observing the gap between Oms expanding into silence. This leads to the experience of inner silence, expanding awareness beyond the body, merging into a state of bliss and creativity. Cyclic meditation is a practice alternating stimulation and relaxation, combining yoga's mudras/asanas with awareness and relaxation periods. Steps include a starting prayer, instant relaxation technique, IRT, involving tensing and releasing the whole body, linear awareness exercises focusing on body sensation and vertical posture, standing stimulation and relaxation, like Ardha Chakrasana, quick relaxation technique, QRT, focusing on abdominal breathing and relaxation, sitting asana sequence, like Vajrasana and Susunkasana, and concluding with deep relaxation technique, DRT. The overall process aims for deep rest and self-awareness. Chapter 10, Kriyas, Cleansing Techniques. Kriyas are special yogic techniques developed by yogis to cleanse inner organs. While daily activities like bathing are common kriyas, yogic kriyas are more specific. 6 major kriyas, called Sat kriyas, are considered comprehensive. General benefits include activating/revitalizing organs, toning functions, desensitizing hyperactive reflexes, and promoting deep internal awareness. Simplified versions like Niti, Kapalabhati, Agnisara, and Vamundati are used. Specific kriyas described include Trataka, gazing, especially at a candle flame, a cleansing technique that improves concentration, willpower, and eyesight while releasing impurities through tears. Niti practices, Jala Niti, nasal wash with saline water, and Sutra Niti, nasal cleansing with a catheter/thread, clear the nose and pharynx, increase willpower, and desensitize individuals with nasal allergies to irritants. Limitations are noted for Niti practices, such as avoiding them in severe back pain, hypertension, cardiac problems, and late pregnancy. Vamanadati is a stomach cleansing technique involving drinking lukewarm saline water and vomiting it out. Viparitakarani Kriya, considered a cleansing technique in an inverted posture, stimulates and tones the urogenital and excretory systems and relieves constipation. Chapter 11, Meditation and the Science of Emotion Culture. This chapter explores the integration of meditation and emotion culture within the integrated approach of yoga therapy, IAYT. It highlights that modern research supports the deep rest provided by meditation. The IAYT works at all 5 kosa levels, Annamaya, Pranamaya, Manomaya, Vijnanamaya, and Anandamaya. The science of emotion culture addresses AD, mind-originated ailments, as the root cause of modern diseases, via D. Setting right unseen imbalances at the mind, emotions, and prana levels can prevent diseases, promote health, and remove symptoms. At the Vijnanamaya kosa level, wisdom and analysis are used, drawing knowledge from Upanishads. Lectures explain the concepts of health, disease, AD, and how yoga operates at the different kosa levels, challenging conventional notions of stress, misery, and happiness. Yoga counseling is used to help individuals apply this wisdom to their specific problems, diagnosing psychological issues that can manifest as physical diseases. Counselors identify issues in various dimensions, including hereditary tendencies, psychological conflicts, and questioning life's purpose, offering solutions and substantiation. At the Anandamaya kosa level, the focus is on bringing bliss and happiness into daily life through karma yoga techniques. This involves learning to alternate relaxation with work, and eventually working with blissful awareness. This inner cleansing process helps release deep-seated stresses and blocks from the subconscious, allowing the manifestation of inner divinity. Realizing the importance of mental silence, slow breath, muscle relaxation, and experiencing bliss leads to blossoming happiness and positive health. A summary of practices at each kosa level is provided: Annamaya, loosening, asanas, kriyas, diet, pranamaya, kriyas, breathing, pranayama, manomaya, dhyana, bhakti, devotional songs, vijnanamaya, jnana, lecture and yogic counseling, and anandamaya, working in blissful awareness. Chapter 12, Yoga, Chair breathing. This chapter describes an 8-step yoga procedure specifically developed for asthmatics experiencing severe airway obstruction, who often require intensive medical intervention. This technique, called yoga chair breathing, is based on the yoga knowledge base. The procedure includes steps like neck muscle relaxation with chair support, involving movements with and without breathing, and with chanting Akara and Mkara, Ardha Chakrasana, Padahastasana movements, with and without breathing, and with Mkara chanting, and quick relaxation technique, QRT, phases focusing on abdominal breathing and relaxation. The technique initially takes 30 to 35 minutes but can be reduced to about 20 minutes with practice. It is noted that this technique can be used during an attack of wheeze instead of bronchodilators and can help patients learn to overcome bronchospasm effectively. Chapter 13, Research on Yoga for Asthma, a review. This chapter reviews research supporting the benefits of yoga for asthma. The authors observed beneficial effects since 1977 to 78 and developed integrated yoga therapy modules based on scriptures and observations. Encouraging results were seen early on, with severe asthmatics who used high medication showing significant benefit within 2 weeks of attending a non-residential camp. Rigorous matched controlled studies with 54-month follow-up provided convincing evidence for the benefits of IAYT in asthma. Results published in the British Medical Journal in 1985 showed an 80% reduction in medication for the yoga group, compared to a 10% increase in the non-yoga group, reduced attack severity/frequency, and significantly improved airway caliber. This generated significant attention in media outlets. Further studies, including a 1986 follow-up in the Journal of Asthma and Cross-Cultural Studies in the USA, supported these findings, showing significant relaxation, positive attitude, and reduced inhaler usage. A study published in 1991 demonstrated the efficacy of yoga chair breathing in relieving 70% of asthma episodes within a mean of 30 minutes without needing inhalers. Other researchers also found beneficial effects of yogic breathing. Research also explored whether yoga reduces basic airway hyperreactivity using challenges like methacholine or exercise. Studies showed that after yoga practices, asthmatics could tolerate significantly higher concentrations of methacholine and had reduced exercise lability of airways. Although mechanisms require further study, research has shown a significant reduction in eosinophils, inflammatory cells, in the blood after yoga. The chapter concludes that modern medical scientists are recognizing mind management as an important component in treating asthmatics. While modern drugs exist, yoga offers a different approach and paradigm for understanding and tackling asthma. The evidence suggests an inherent freedom in man to master physical responses by manipulating the mind and vice versa. There is a section on integrated yoga module for asthma and index. These sections provide structured lists of the practices included in the integrated yoga module for asthma, detailing page numbers, suggested rounds, and durations for daily practice and the chair breathing technique during acute episodes. This final section describes the book as part of a series on integrated approach of yoga therapy for modern ailments published by Swami Vivekananda Yoga Prakashana. It reiterates that the authors, scientists, have developed modules based on traditional texts and modern medical understanding, validated by research published in journals since 1980. It highlights Vyasa's extensive experience, having treated over 1 million asthmatics globally with consistent results, including significant medication reduction and improved lung function shown in long-term studies. Yoga training for asthmatics includes asana, pranayama, meditation, cleansing, and lifestyle changes to overcome airway hyperreactivity. The book's structure covers modern medical understanding of asthma first, followed by the theoretical yoga therapy background and practice descriptions. It mentions the included modules for daily practice and acute episodes and lists the credentials of one of the authors, Dr. R. Nagratna.